Known as primitive reflexes are involuntary actions or responses to stimuli that are inborn in babies. These reflexes are an important tool used to assess an infant's neuromuscular status. In this video, we will talk about 3 important topics: reflex names, which will be 8 common baby reflexes; reflexes, triggers, and responses, which is how to trigger these reflexes and what is the baby's appropriate response to it. We will also cover when the reflex disappears. Baby reflexes disappear over time to indicate proper neuromuscular development, and if they do not go away, this would tell us if there's a neurodevelopmental disorder. So for our first reflex, we have the rooting reflex, which is used to help assist the baby in breastfeeding. The rooting reflex is triggered when the baby's cheek or side of mouth is stroked. As a response, the infant will turn their head towards the stimulus, mouth open and ready to suck. The rooting reflex disappears around 4 months. Then we have the sucking reflex. This is triggered when something touches the roof of the mouth. As a response, the infant will start sucking. This reflex will disappear and become voluntary after about 4 months of age. Then we have the moral reflex. This is our most primitive reflex. The moral reflex is also called the startle reflex. This reflex will be triggered when an infant experiences a sudden shift in balance. This may include an unexpected movement, or a sudden loud noise can trigger it too. In response, the infant will extend their arms and legs, palms facing usually outwards, and then followed by the baby bringing their arms to their core. This response is sometimes including crying or an open mouth. This reflex disappears after 6 months or half a year. We then have the crawling reflex. It is triggered when the baby is placed on their stomach and pressure is applied to the sole of the foot. As a result, the baby attempts to start crawling. The crawling reflex disappears within a few weeks to a few months after birth. Moving on from crawling to stepping, the stepping is triggered when the baby is held upright with feet touching a hard surface. In response, the infant will move their legs as if taking steps. The stepping reflex disappears around or after 3 to 4 months. We then move on to our tonic neck reflex. The tonic neck reflex, or the fencing reflex, is triggered when the baby's head is turned to one side. You should expect to see the arm and leg on that side extend, while the arm and leg on the opposite side flex. This reflex will disappear around 4 months. The grasping reflex. The grasping reflex also occurs on the hand and foot, plantar and palmar. The palmar meaning hand and the plantar meaning foot. The palmar reflex can be triggered by placing a finger in the baby's palm. As a response, the baby's hand will close around it. This palmar grasp disappears between 4 to 6 months. Then we have our plantar grasp reflex. Again, the foot. The plantar grasp reflex is triggered when a finger is placed under the baby's toes. In response, baby's toes curl downward and around the finger. The plantar grasp disappears around 9 months to a year. Then we have our final reflex. This is the Babinsky Reflex. It is triggered when the bottom of the foot is stroked. In response to this movement, infant's big toe dorsiflexes while the other toes fan out. Think of drawing baby skis with your finger for Babinsky. And this is our longest reflex, lasting about a whole year, and is developmentally important. The whole idea of this reflex remains unknown, but indicates good spinal tract neuromuscular development.
Thanks for watching. If you found this video useful, don't forget to like, share, and subscribe for more medical information, and to really help you on your next exam.